Hypertension is a condition in which the blood pressure is raised. That is, we normally like people or patients, our patients, to have a blood pressure of not more than 140 millimeters of mercury systolic over that of 90 millimeters of mercury diastolic. You've taken blood pressure, you know how to get these levels, so I need not bother wasting your good time. But for those of you who've just bought your monitors and are new to this game, it may be a little bit daunting because you have systolic blood pressure to think about, you have diastolic blood pressure to think about, you have millimeters of mercury to incorporate into this equation. And so just to clear the air, blood pressure, whether it's taken by your GP or his nurse, your midwife or your dentist, or by your good self at home, is expressed as two numbers. And it is written as a fraction. The higher number sits at the top of the fraction, and the lower number sits at the bottom of the fraction. The higher number is called the systolic blood pressure. That is the pressure within your blood vessels, within your arteries, when the myocardium is contracted at its peak against millimeters of mercury. And we normally do not like people to have a systolic blood pressure of more than 140 millimeters of mercury. The optimum is that of 120 millimeters of mercury. The lower number, which sits at the bottom of the fraction, is called the diastolic blood pressure. That is the pressure within your arterial system when the myocardium is filling up between contractions. And we normally do not like people to have a diastolic blood pressure of more than 90 millimeters of mercury. The optimum level is 80 millimeters of mercury. Now, the World Health Organization in Geneva says that if your blood pressure is 160 millimeters of mercury systolic over that of 95 millimeters of mercury diastolic, then you are hypertensive.